Live from the Channel 11 studios, it's Great Day Houston.
Up next, hormonal imbalances affect men, women, and children. We'll show you how you can bring balance and health back into everyone's lives. Everybody, we're still taking your health and medical questions this morning. You can email us at greatdayhouston@khou.com or call us at 713-284-1055. The symptoms of hormonal imbalance can affect men, women of any age. They can also affect children. Our next guest has some simple solutions. Please welcome back Dr. Stephen Hotze with Hotze Health and Wellness Center to the show. Hi there. All right. Let's just start with, because we always say hormonal imbalance. What exactly does that mean? Because there is a certain range where things may shift a little bit, but when do we have a true imbalance?
When we think of hormonal imbalance, we're thinking about female hormonal changes as opposed to male. Men have hormonal decline. Women have hormonal imbalances because in a perfect 28-day menstrual cycle, once a woman hits puberty, if all things are working fine, 28-day menstrual cycle. Day one's the first day of her menstrual period. That lasts 3 to 5 days, and then she will cycle again in 28 days. During that time, two major groups of hormones are produced, female hormones. The estrogen hormones, estriol, estradiol, estrone, they're proliferative hormones. They cause the proliferation of breast tissue, the inner lining of the womb. It gets it all, the womb growing, and then mid-cycle a woman will ovulate, and then she'll make progesterone. So that's the other class that has to balance.
Right,
and when these balance properly, then a woman has really no premenstrual symptoms. She has her period and it's fine. When there's an imbalance, women will begin to have maybe severe headaches or migraine headaches. They get breast tenderness, mood swings, fluid retention, weight gain. This can start a day or two before the period. Some women, it lasts 2 or 3 weeks before the period they have these symptoms.
Right.
So what we want to do is balance out in a woman's menstrual life, balance out her hormones so she doesn't have those significant problems.
And then for men, of course, you mentioned the decline.
It's a decline. Now, women's hormones decline as well, but they're always balancing every month. That's why it makes treating women more difficult than treating men, because you got to balance things out, and that's done a lot of times very subjectively.
Yeah. Now, speaking of menopause, I just want to, we're getting into the menopause phase. We have Renee on the line. Good morning, Renee.
Good morning.
And you have a question for Dr. Hotze?
My question has to do with, I haven't had a menstrual in about a year, but I'm having terrible hot flashes throughout the day and through the night. Should I be on some type of medication?
Should I be what?
Should she be on some type of medication is what she's saying.
You've gone into the change of life. Menopause is when your menstrual periods stop. They've stopped for you. You're having hot flashes, so you're having you've gone through the change. So yeah, you do. You've got to replenish your hormones. If you want to feel well as you mature and as you age, it's essential that you restore the hormones that you used to make at optimal levels when you were young. The aging process leads to the deterioration of our glands, our endocrine glands that make the hormones. As they decline, we make lower level hormones and we age. We look it, we feel it, we act it.
Right.
If we want to look and act and feel old, just don't do anything.
Yeah, and she said a word there. She said, should I be on medication? Is medication the same as hormones?
Well, no, it's not. Hormones, if they're biologically identical, they're the same identical molecule your body used to make. If they're synthetic or drugs, they're something that never existed before in nature, and I would not recommend that. I always recommend using the biologically identical hormones. The patients do a lot better with that.
Okay, so with women, there's the age of going through the menstrual cycle and then getting into menopause. With men, we mentioned decline, but with children, and people will say, of course, there's a hormonal imbalance when you're going in from puberty to the teenage years, but when do you know that imbalance is not normal?
Well, you know it's not normal when you're having symptoms of irregular menstrual periods, you have severe mood swings, all the premenstrual symptoms that women commonly have as they start off in interpuberty. And guess what happens? Most, unfortunately, women get taken to the doctor when they're young girls, and the doctor puts them on birth control pills to regulate them.
Yeah.
When what we're doing is shutting down their normal occurring hormones, and we're giving them synthetic counterfeit hormones, which can cause a host of problems. And then the next thing you know, they're on antidepressants and they have a whole host of problems. That's when hormonal imbalance is essential. A woman can be balanced out. A young teenage girl is having menstrual irregularities or mood swings or breast tenderness, a host of problems. A little bit of progesterone, day 15 through 28, can solve that problem.
All right, and then quickly here, my name is Nancy. I've been advised by my OBGYN to take Zoloft 14 days prior to my period to help with my PMS problems. I think
Here's the difference. Mainstream medicine and the pharmaceutical companies want us to use drugs. We want to maintain our good health, and what the woman should take, rather than Zoloft prior to her period, she should take progesterone, which is the natural occurring hormone that will level things out, and her mood should be fine.
All right, Dr. Hotze, thank you very much.
Thank
for more
you.
of an explanation about hormones and all that stuff and testimonials, Breakthrough, 8 Steps to Wellness. This is the book by Suzanne Summers, where she's dedicated a portion of this book to you, Dr. Hotze, for the work that you do. For more information about the Hotze Health and Wellness Center, you can log on to hotzehwc.com or call 877-698-8698. All right, we have Kelly.